There is no such thing as bad or good cholesterol. Today we're debunking myths and going through what you need to do to protect your heart. Cholesterol is a waxy, fat-like substance that's found in all cells in the body. Your body needs this cholesterol to make hormones, vitamin D, and help to digest your foods. But there's a problem. Cholesterol doesn't mix with blood. Think of trying to mix oil and water. It doesn't work and they separate out. Instead, the cholesterol is packaged up into vehicles called lipoproteins. So LDL, or low-density lipoprotein, simply refers to the density of the cholesterol that's packaged into that lipoprotein. The cholesterol structure itself is exactly the same, whether it's transported in a high-density lipoprotein or a low-density lipoprotein. The cholesterol itself doesn't cause heart disease. Instead, it's the concentration of the cholesterol-carrying lipoproteins in the blood that really matter. And here comes the yelling from the keto and carnivore influencers, who will say things like cholesterol-carrying lipoproteins don't matter. What matters is insulin resistance and your overall metabolic health. They'll bring up graphs like this one, showing that low-density lipoprotein levels are associated with higher death rates, and the ideal LDL cholesterol level is 140 milligrams per deciliter. Now, the stakes are high. We absolutely need to get this right, so that we can prevent heart attacks and strokes. This is not to be trifled with. So let's unpack this myth step by step. Firstly, this is an observational study, so all the authors did was simply observe the population to see what trends they could see. But correlation doesn't equal causation. Instead, what's happening is that these low levels of LDL cholesterol are largely a marker of severe disease. Essentially, when a population is observed, those who have got chronic diseases, such as cancer or chronic kidney disease, they often have low levels of LDL cholesterol. Instead, we know that when we actively intervene and lower a person's LDL cholesterol levels, we lower the rates of heart disease. And we know this from randomized controlled trials. Cue more yelling from the keto and carnivore influencers, who will say that those results are explained by reduced inflammation levels, that when we actively lower a person's LDL cholesterol levels, we're also lowering their inflammation, and it's the lower inflammation levels that are responsible for the lower cardiovascular disease. It's got nothing to do with the LDL cholesterol levels. So let's address that point. We have a massive trial called the PISA study, PESA, and it enrolled over 4,000 individuals who underwent 3 yearly examinations looking for blockages in their blood vessels. What they found is that for people that had optimal values for their cardiovascular risk factors, so they were insulin sensitive, they were at the perfect weight, they had low levels of inflammation, there was still a significant correlation between LDL cholesterol levels and the presence of blockages in blood vessels. And we can see this quite clearly on the graph, where as the LDL cholesterol levels increase, so too does the chance of developing blockages in our blood vessels. Again, what this trial tells us is even if you don't have insulin resistance, if you have low levels of inflammation and you are a perfect weight, you can still develop blockages in your blood vessels if the concentration of the cholesterol-carrying lipoproteins is high enough. And when you lower that concentration, as evidenced by the randomized controlled trials, you lower your chance of blockages in your blood vessels. You lower the chance of heart attacks and strokes. Now, one criticism of the PISA study is that in the very low LDL cholesterol group, there was only 2 participants. This is because without using medications, it's almost impossible to reach these low levels of LDL cholesterol. You have to have won the genetic lottery, so it's very rare to have LDL cholesterol levels this low. However, as the numbers of participants increase, again you can quite clearly see the trend, where as LDL cholesterol levels increase, so too do the chances of developing blockages in our blood vessels. And taken together, this supports the idea that the lower your LDL cholesterol levels are, the better, as in the more protected you are against heart attacks and strokes. So how does a high concentration of low-density lipoprotein particles cause blockages in our blood vessels? Like I mentioned earlier, correlation doesn't equal causation. We need to have a firm mechanism for how LDL particles can cause blockages in our blood vessels, and this was explained beautifully by the European Atherosclerosis Society. They explain that LDL particles, they don't just passively move across blood vessel walls. Instead, there are specific pathways to cross the blood vessel walls, and this is called transcytosis. The take-home message before we move on to the next point is that if the LDL particles reach a certain concentration, even if you are metabolically healthy, you are insulin sensitive and you've got a perfect weight, you can still develop blockages in your blood vessels. And it's not the cholesterol itself, it's the concentration of the cholesterol-carrying lipoproteins that really matters. But lipoprotein concentration isn't the only factor that we need to worry about. We still have to address all of the other risk factors, including insulin resistance, blood sugar levels, inflammation, blood pressure, weight. All of those risk factors, including lipoprotein concentrations, need to be addressed to reduce our chance of heart attacks. So coming back to lipoproteins, which lipoproteins do we need to worry about? Because on a regular lipid blood panel, you'll see LDL cholesterol. That's a measure of the amount of cholesterol that the LDL particles are carrying. It doesn't actually measure the number or concentration of the LDL particles. And it's not just LDL particles that contribute to blockages in our blood vessels. There are different types of LDL particles, such as small dense LDL, oxidized LDL, and there's lipoprotein a, just to name a few. So just relying on LDL cholesterol is an incomplete marker. Ideally, if my patients have the resources to fund it, I encourage them to check their ApoB levels. ApoB is a primary protein component of lipoproteins that cause issues with respect to our blood vessels. It's the ApoB family of lipoproteins that can be retained in our blood vessel walls, again leading to blockages. You'll hear some people talking about oxidized LDL or small dense LDL, that those are the ones to worry about. That has been debunked. It's the concentration of the ApoB containing lipoproteins that really matters. And for my patients that I see at the clinic, we aim for ApoB levels below 60 milligrams per deciliter. But as mentioned earlier, there are costs involved in measuring your ApoB levels, so if we have to rely on LDL cholesterol levels alone, we still target a level below 60 milligrams per deciliter. Now you'll notice that that level is significantly less compared to the American Heart Association guidelines. And I'll reference the PISA study again because we can see that if the LDL cholesterol levels are above 60, that's when it seems that atherosclerosis or blockages in our blood vessels can occur. The next question is, why don't we pay that much attention to the HDL cholesterol levels that are also commonly measured on a standard lipid blood test? It used to be thought that by raising the concentration of HDL particles, we could be protected against heart disease. Unfortunately, those studies failed, and that's why clinicians instead focus on ApoB levels. So how do we lower ApoB containing lipoproteins? Well, we always start with diet, and we don't just want to focus on a diet that lowers ApoB levels. Ideally, we want a diet that also helps to lower blood pressure and lower our weight. So to provide a quick summary, we want a whole food, high protein diet, but the proteins that we select should be lean, as in low saturated fat. We know from a Cochrane review that as we lower our saturated fat intake, we lower the chance of heart attacks. And a quick note that saturated fat is different to dietary cholesterol. So for most patients, dietary cholesterol that's commonly found in things like eggs doesn't have a huge impact on our blood cholesterol levels. It's the saturated fat that increases our blood lipoprotein concentrations. We also want to focus on high fiber foods, because again from Cochrane, we can see that as we increase our fiber intake, we lower our total and LDL cholesterol levels. And in terms of blood pressure, we want to be consuming high potassium foods, such as beans, lentils, avocados, spinach, broccoli, and peas. And of course we want to be exercising. Now if diet and exercise aren't enough, there are a myriad of cholesterol-lowering medications that we can use. So make sure to check out this next video here on the medication that I use in addition to diet and exercise to lower my cholesterol levels.